Okay,
Welcome to this panel on Muslims and medicine. My name is Mohamad Khalil. I'm the director of the Muslim Studies program at Michigan State, and we're delighted to have you with us. We have a panel of three distinguished presenters, and we'll get right to it, actually. We'll begin with Dr. Reza Nassiri. Dr. Nassiri is Doctor of Clinical Laboratory Medicine at the University of Paris and is the former Associate Dean of Global Health at Michigan State. In the College of Osteopathic Medicine, College of Medicine, I'm sorry, and former
osteopathic.
director, Osteopathic Medicine, I'm sorry, and the former director of the Institute of International Health at MSU, and former professor of Family and Community Medicine. And his fields of expertise include global health, infectious diseases, antibiotic resistance, nosocomial infections, public health capacity building, and clinical investigation. And I'm delighted now to turn it over to Dr. Nassiri.
Okay, thank you, Dr. Khalil, for your generous introduction. Let me share the screen. There we go. Can you see the slide?
Yes.
Okay, let me enlarge the slide so you could see it better. All right. Well, again, thank you so much for your generous introduction. I think this is very timely webinar, considering what's going on around the Muslim world and the type of disharmony we have among Muslim nations. I wouldn't say Muslim people, or nations meaning the governments. Okay. So I take it, as a good opportunity to reintroduce Muslims and how they contributed actually to not only to the essence and the knowledge of medicine, but also things we cherish these days when it comes to therapeutics and diagnostics, especially pathophysiology. We owe it, to some Muslim scholars and scientists, and one of them is Avicina. So on the next slide, I would like to briefly review his life. And he was born actually in Afshane. Afshane, those of you of Persian or even Arabic, background, Afshane has a lot of meanings, but one of them can be splendid. Okay, so he was born in Bukhara, Persia, okay, in 1980, and father was Abdullah. Again, for our English viewers, Abdullah means person who praises God. And he was a local governor of Afshane in Bukhara province. And the mother's name, I love it, was Setare. Again, Setare is a Persian name, means star. And of course, he died in the city of Hamadan, Iran, in 1035. And I was privileged, utterly privileged, to go and visit his mausoleum there. And also, I gave a lecture at the University of Hamadan School of Medicine there. And part of my lecture was actually about Avicina and how he contributed to our understanding of some of these pathophysiological mechanisms. Of course, in the Western world, they know him as Avicina, but in Persian and Arabic world, he is referred as to Al-Sheikh al-Ra'is. Again, forgive my Arabic pronunciation. Dr. Hussein can pronounce it better, but that literally means the preeminent scholar. Now, I want to take you back to the map of Persia, and you can see this was a huge empire from east, including part of China, all the way to Greece. So for your information, Persians were indeed neighbors to Greeks. And that is why when it comes to Greco-Persian history, and you can find, there were exchanges of cultural issues, as well as, scientific issues and of course, literature. So you can see here, for example, the Republic of Azerbaijan, okay, was part of Persian territory, currently now Iran. At that time, Turkey did not exist at all, okay? It's a new country, and especially these Caucasus Mountains, the Safavid dynasty in Persia, they lost it over Russians, then they all got fractionated to Republic of Azerbaijan, Armenia, and then Georgia. You can see there's a lot of conflict going on, and now Turkey is showing the muscle over here. It's a big mess. Anyway, I don't want to go into politics of it, but you can see that Persians, they had presence even in Egypt. So for Dr. Hussein, my good friend, Dr. Hussein, Dr. Khalil, please know that we Persians, we had some kind of presence, in your country, all the way to Libya. And my advice for Dr. Abbasi and also Dr. Zaki, if she's hearing me, is maybe you should send your Sweden sample for DNA analysis. You might have a Persian gene. So going back to Avicina, he has published, written, and 5 books in medicine. In Persian, we call it Qanun der Tib, the canon of medicine. Now, Avicina, if you Google it, has so many quotes in science and medicine, and I have chosen one. The first one, he said, knowledge is forever. And the second one is the knowledge of anything, since all things have causes, is not acquired or complete. And then I love the rest of the sentence, unless it is known by its causes. I don't want to go over Dr. Hussein's area of hematology. It's like, we see our patients has low hemoglobin, low hematocrit. We just say, well, you have anemia. Well, we need to find what is the source of anemia. What is causing anemia? That was precisely Avicina was arguing about. So as I said, his books, he was also a philosopher as well, but sticking on the medical aspect, there are 5 volumes, okay? Volume number 1 is really, a golden star in the principles of medicine, which has 6 skills, and each of these 6 skills has sub-skills. In just a few minutes, I'll come to that. Volume number 2, it's about remedies, okay? My terminology, as I have studied Avicina in detail, in case of, modern, and clinical pharmacology, he talked about monotherapies, and especially, herbal remedies and minerals. As a matter of fact, as far as clinical application is concerned, he spent many, many years on studying liver disease at his time, okay? I want to emphasize at his time, and also looking into herbs in his area and trees that had anti-inflammatory properties. And his work is acknowledged even by Greek physicians. As I said, at that time, Persia and Greece, they were neighbors, and they were exchange of scientific ideas. So as far as herbs are concerned, some of our modern scientists, they call Avicina's herbs as hepatoprotective herbs. As a matter of fact, when you break down all of these herbs, by the way, that 52 herbs, he discovered it. Okay, it comes in book number 2, and then you can see some of the herbs he described. Still, we use them one way or other as different ingredients in our modern medicine. But in general, if you were to classify 3 major compound drugs he described, it would be from Crocus, sativus, and Pisticum, lenticus, and also the cinnamon families. And I gave, example, these are huge families, but I just gave sub examples such as saffron, mystic trees, and the cinnamon itself. So you can see that he really tirelessly worked on not only identifying, herbs from different sources, but at least 18 of these herbs, we use them, in a different ways in our modern medicine. The book 3, volume 3, he described anatomical illnesses. It has 2 sections. Section 1 is the brain and the nerves. And then he goes on, in section 2, describing ears, diseases associated with ears, nose, mouth, and tongue. And then on book 4, okay, he specifically described, dermal complications or especially dermal infections, particularly acne, and he did recommend few herbal remedies as topical for treatment of acne, and this is so astonishing. And I spent a great deal of time and the Library of Medicine. And when I was growing up in Paris, France, the Library of Paris National Library of Medicine, and even, in Bologna, when I was associated clinical professor there, I spent the time in their library looking at what he described as the color of the nail. And indeed, that's Dr. Hussein's expertise. We can identify some kind of anemias, let us say iron deficiency anemia, just by looking at the color of the nail. Like this one is pale pink. We call it winter nail. That is indeed an example of iron deficiency anemia, which, excuse me, Avicina in his time eloquently described it. And this aspect always, when I give lecture, it's quite astonishing, which is very much consistent with our modern, hematology. And then the last book, book 5, specifically talks about compounds and remedies. In addition, he talks about evidence-based herbal therapies, and he went actually in length how to prepare the syrups, oil, and creams, especially, last 2 for dermal diseases. So going back to volume 1, okay, I just want to give you an example. In volume 1, he describes the vascular system in our body, okay, and particular emphasis on blood vessels and the diseases that relates to anomaly or abnormalities of blood vessels, and then he in length describes musculoskeletal structure of a human body. And you can see this is the Arabic description. I copied it, in addition to describing the circulatory system, musculoskeletal system. He also talked about psychology, and he basically labeled as lack of energy. Now, I should point out and clarify or disclose that not all of his pathophysiological descriptions that Avicina made in his time, I repeat, in his time, is correct. Some of them he described according to our modern discovery with advances in medical tools, and especially in molecular, biology advances. We know that some of them, were not correct, but at least he laid down, some of the foundations that we cherish now and as part of the history of medicine. Well, there are several books published by different investigators, many of them. I mean, these two are Iranian investigators, okay? And this one, it tells you about, how, through his books, the healing can occur. And this one is more or less on philosophy of medicine. And of course, there are several, Latin and English and even French, books, by different authors that describe, Avicina and how he is regarded as the father of modern medicine. So this is from International Journal of Cardiology, okay? So they describe that Avicina's contribution in cardiology was indeed significant, and keep in mind, the golden era of Islam is between 9th and 12th, century, all right? So basically, during this golden era, now with the background and the history we have about Avicina, many scientists, especially in Europe, not much in United States, maybe with the exception of few universities that I know, they regard Avicina as a scientist who has developed the medical knowledge of the medieval epoch. So this is the statue of Avicina in Hamadan, Iran. And here is the mausoleum. As I said, I was privileged to be there and give a lecture, in their medical center in Hamadan many years ago. So this one is by Russian scientists, and the scientists, many scientists by Kyrgyzstan, okay? Again, they acknowledge contribution of Avicina in cardiology, and they quote that Avicina's contribution is Kitab Adviyat Ghalbi, okay? Kitab means book, okay? Adviyat is a Persian, I'm not sure, it could be Arabic as well, means strengthening, okay? And Ghalb means heart. Therefore, they came up with this translation, the book on drugs for cardiac diseases. However, as a person who I studied Avicina many years, and I used to even give lectures in medical residency program, not in MSU. I don't think MSU knows who I am. Anyway, I would always quote this, but with a minor difference, as I come from Persian background and I'm familiar, even though I grew up in Paris, but I'm familiar with Persian literature. I would probably say that, that the compounds that strengthen heart function, that would be a better description. However, this description is not far away. Now, in his third book, volume 3, he specifically describes gastrointestinal disease and including, bowel obstruction, hemorrhoids, fissures, and also fistulas. Now, here's another publication about, there's several publications. I had to just be picky to choose few of them about Avicina. And this was published in Heart Views, again, his contribution in circulatory system, okay? And this is what, Avicina said, medicine is the science by which we learn the various state of the human body in health. When not in health, the mean by which health is likely to be lost, and when lost, is likely to be restored to health. So the author's conclusion of this lengthy paper was undoubtedly Avicina of Persia is one of the greatest physicians in Islam and one of the greatest thinkers and medical scholars in history. Avicina also focused, and this is Farsi script, which is a little bit similar to Arabic, Avicina focused on three major health issues. One would be exercise, and he used to get up early morning. After prayer, he would engage in exercise. And he had actually on book 3, volume 3, some guidance how to take food or nutrition. Okay, for example, one of the things he absolutely discouraged the people of his time was when they are eating, they should not take water. They should wait until they're finished with their food intake and then take water. And his explanation was that if you just take water in the middle of eating, it will, interfere with the enzymatic secretion of stomach, the type of enzymes that we need, to digest. So another word, he was really ahead of his time when it comes to gastrointestinal disorders. As a matter of fact, one of the major, disorders, according to World Health Organization, because I consult for them, is the eating disorders that we have, especially in the United States, And also he has guidance on sleep, and he describes it, deep sleep versus superficial sleep, and how fatigue can interfere with the pattern of sleep. So this is from University of Tehran, actually, one of the scholars over there, he basically is saying that, whatever code we hear from Avicina, we should engrave it with gold. And one of the saying of Avicina was, everything in minute amount is medicine. In moderate amount is food, okay? In excessive amount is poison. But he ended up very eloquent phrase. He said, including kindness. So in other words, he integrated, the concept of medicine with philosophy. Now, as far as Greek medicine is concerned, they regard Abyssina as prince of physicians. And I was privileged to be invited by University of Alexandroupolis in the teaching hospital. That's the northern Greece near Turkish border. And while I was giving, a seminar topic, they also asked me to prepare a few slides about Abyssina, which I did. That was many, many years ago when I had clinical collaboration with Alexandroupolis in Greece. Now, University of Bologna in Italy is one of the oldest, and some even say the oldest, and they have a huge library. And before I joined Michigan State University, when I was in Pennsylvania, I had the opportunity to be visiting a professor of virology at the University of Bologna Medical Center in St. Ursula Hospital. And Professor Maria Paola Landini was my host over there, and I spent the entire summer over there. And she did ask me to deliver a seminar on Avicina. I did, but to my astonishment, when I went to the Library of Medicine, I found several Latin books, as I speak French, Latin language is a little bit easier for me to understand. And I was quite astonished and quite impressed, how much they value about, the contribution of Avicina in this university. And their medical program is one of the best actually in Europe, but also in Kyrgyzstan, okay, and they have Avicina International Medical Institute. What they mean by medical institute, it's also medical school as well. In a Russian tradition, institute means also a medical school as well. As a matter of fact, when I used to take medical students from MSU with me to St. Petersburg for HIV and hepatitis program I developed with St. Petersburg, and when you enter, their teaching hospital, there you see a statue of Avicina. As a matter of fact, in 1 year, one of the medical students was a Muslim, and she asked me about that. And I told her, don't worry, in the evening time, I will give you a lecture, a private lecture on Avicina. Okay. Now, in Iran, okay, because now Persia is now confined to Iran, and they honor Avicina. As a matter of fact, every August 23rd, it's called Avicina Day, and they congratulate doctors and other healthcare professionals, but also every year, the Secretary General of the World Health Organization, like this year, Dr. Tedros, he sent out a message, to all Farsi-speaking countries, congratulating them, on the day of Avicina, which is always August 23rd, okay? So how do we remember this eminent scholar, okay? Well, when you look at all the books and the philosophy he had, you can come up with some key points. For example, he is regarded as the founder of evidence-based medicine. He's the father of anatomical physiology, although, as I said, for clarification, some of the physiological pathway he described didn't turn out to be the way it is in modern medicine. Definitely, he's the founder of herbal medicine practice. Most importantly, the founder of pharmacopoeia. As a matter of fact, if you go to Switzerland, Germany, Austria, and talk about Avicina, they immediately tell you that he is indeed the father of pharmacopoeia, And also, most importantly, he is the founder of philosophy of modern medicine. And this is what he said: a necessary being would be one whose essence is such that it does necessitate its own existence. It does not need existence added to its essence in order to exist. And this can only be because its essence is existence. When they asked Avicina about this sentence, he basically replied, this is the description of Allah, which in English means God. So he can be remembered as a scholar that created system, holistic system. As a matter of fact, some of these osteopathic principles that we come across, coincides the way that Avicina described, but unfortunately, in many osteopathic colleges, they don't even know what Avicina is, okay? And so basically, he has two books. One is called Kitab-e-Shifa, that's in Farsi. That means the Book of Cure, okay? And it's vast philosophical and scientific encyclopedia. The other one is Qanun-e-Tib, okay, the canon of medicine, which is very popular and which is, the topic of my webinar today. So, in conclusion, if we go back to Avicina's work, he is quite inspirational. Inspirational in the context of clinical teaching and medical research. I wish we had a program at MSU. We could at least give a seminar topic every year for medical students and medical residents even, I used to do it, when I was in Ann Arbor, actually, faculty in Ann Arbor, His work is universally recognized, okay? And he basically advanced in what we have in modern medicine. As you know, in modern medicine, there's a lot goes into it, research, experimentation, and the development, and much of it, these scientific discoveries and knowledge we have really goes back to Islamic world, and that is between 9th and 14th century, which is referred as golden age of science in Islam, and certainly Avicina, along with a couple others, especially in North Africa, which I didn't have a time to go over those contributions, is pretty much recognized worldwide. By the way, Avicina is officially recognized, not only his work, by the World Health Organization. And when you go to World Health Organization, there is a corner where Avicina's statue is there, and also recognized by the United Nations. So I would like to end the seminar topic here, or rather webinar. And I think it is at the end, Dr. Khalil, right? We get questions and comments. Am I correct?
That's right. Yeah, we'll save questions for the end. Thank you so much, Dr. Nassiri. We appreciate it. And actually, I'm going to be discussing Ibn Sina in about 2 hours in my Intro to Islam course. So you've given me some great material to work with. Thank you. Our next presenter is Dr. Mohamad Hussein. Dr. Mohamad Hussein is a professor in hematology and medical oncology at the University of South Florida, and a former director of the College of Medicine, Internal Medicine. He holds a degree a medical degree from Ain Shams University in Egypt, and is the author of numerous publications and is a specialist in myeloma. So we're delighted to have with us Dr. Hussein.
Oh, thank you. Thank you so much. I really appreciate that kind introduction, Dr. Khalid. So what I'm going to do is really going to be relatively straightforward, not as fancy and elegant as Dr. Nassiri's, but I'll try. Let me see if I can do this right and not mess it up.
It's called humiliation.
No, I think this is it.
Yeah, we can see it.
You can see it. Okay.
Yes.
So basically, what I was going to try to do is a couple of things. One is actually just show a couple of verses of the Quran that highlights really important stuff as far as humanity and as far as the complexity of the human body. So if you go to this slide, basically in chapter 40, verse 57, God basically uses the human body as a reference in the creation, that the universe is more complex than the human body. So the human body, with all of its complexity, it basically is nothing compared to the creation of the universe. And we all know the complexity of the human body, and I'm going to try to address that in the slides, and use multiple myeloma as an example of the complexity of the microenvironment, of the disease pathophysiology, and of the different elements that require some sort of therapy, and we still haven't even touched the surface in it. The other part that's really critical, and sometimes it's misconstrued, is if you save a life, is as if you saved humanity. And this is in chapter 7, verse 32. And this is sort of the presentations and or the projections that usually don't come out. Some of it is blamed on us as Muslims. We show a different side of this, but it basically, our job is to save lives, and this is why medicine is really a sacred bit. I'm going to try to see if I can just get the Okay, yeah, I'm really messing this up. Oh God, I don't want to rehearse. Sorry, guys. This is ending not what I wanted to do. Okay. I can't even move the slide to the next slide. Do this. Okay, here we go. So here in multiple myeloma, it's really a pretty complex environment. And if you look, we would start with the skeletal system and the important pieces in it, the macrophage, osteoblast, osteoclast, dysregulation. Some actually folk believe that this is where the pathophysiology of myeloma happens with an error in this arm of the microenvironment in multiple myeloma. This dysregulation is what results in an aberrant stromal structure where the ICAMs, VCAMs become really involved and critical. And as soon as the ICAMs and VCAMs attach the plasma cell to the stroma, you get significant dysregulation in the cytokines and growth factors, and those sort of interactively result in a significant dysregulation in the cellular components of the immune system. And this is really where the plasma cell becomes malignant. It's supported by the stroma. And in addition to that, it is supporting itself through the cellular system as well as through the different cytokines in the system. What becomes really critical is basically as the cells exceed a significant amount of cytokines, the cell tries to become independent of the cytokine environment. So in advanced disease, even controlling the cytokines, trying to level off the negative impact of the cellular system by enhancing the myeloma cell becomes totally independent, secreting its own cytokines that support itself. So it becomes basically a self that's self-sufficient and does not require hardly anything from the microenvironment to support it. A couple of the things that do happen, you get clonal evolution. The cells develop this interclonal relationships where these cells interact and talk to each other. So even a normal cell can become abnormal from those interactions. There become dysregulation of the cyclins, the oncogenes, tumor suppressors. And this is where the disease towards the end and after a number of years of therapy becomes very difficult to control. What you would see here is a couple of things. The cancer stem cell and the sensitivity to the cellular immune components, that really becomes very critical in how the myeloma cell supports itself. So even if you kill the plasma cells themselves, the myeloma stem cell is still in the background in a reservoir, and those cells tend to be very resistant. And the resistance of them is partly because they are hidden from the immune system. Another component to this is these cells become mutated. The problem is not just the mutation, because some bunch of these cells, those can actually be induced into apoptosis and you lose those cells. What does happen though, that the inference of resistance happens from the mutated cells. They transfer the mutated material to the wild type, and then all of a sudden the wild type sits in the background and is ready to behave as a malignant cell. You see that in some experimental studies done in Waldenstrom's macroglobulinemia, and even though Waldenstrom's macroglobulinemia cells are basically terminally differentiated, and you would think that they would not acquire new translocations from other translocated cells, and that is actually becomes a huge problem, because even if you get rid of the cells that have the genetic abnormalities, some of these genetic abnormalities is communicated back into the wild type, and then the wild type becomes abnormal itself. A really key part in the management of multiple myeloma, and we're far away from understanding that part. There is ton of different cytokines, ton of different stimulators, suppressors. And if you just look at checkpoint inhibitors, there is checkpoint facilitators and checkpoint inhibitors, and there are dozens of each on each side. And depending on where the position of the cell is in the microenvironment, what time of the cell division these cells are in, these checkpoints can act as an inhibitor or a facilitator. And this is really a part that is taking a lot of research and a lot of effort to try to understand and try to figure out where we are in how we would coordinate all these different cytokines, checkpoint inhibitors together, in addition to cellular therapy to manage the disease. And then, this is basically the T cell functionality, which was very elegantly done German study from about 4 or 5 years ago, where they found in patients who do receive allotransplant for multiple myeloma, there were different regions of the multiple myeloma were affected differently by the infused transplanted marrow, which is basically the T, part of it is the T cells. So in the bone marrow, these T cells were very functional and were able to control the environment. Outside the bone marrow, these T cells were not as effective. And the relapses were discordant relapses. You find people relapsing, but then their marrows are clean and so forth. So this discordance, you're having the same T cells, same genomic code in these T cells, same activity, but they behave differently in different parts of the body. And that actually is the influence of the microenvironment. Some of it is the direct influence of the plasma cells on those immune components. Cytotoxic cells are less impacted by the checkpoint inhibitors and appears to be actually more effective against myeloma. And again, that might depend on how the environment is, and this is where it really brings that in the therapy of multiple myeloma. If you're using immune modulators, thalidomide, Revlimid, pomalidomide, the timing of the introduction of these components, let's say with vaccines, for instance, Dr. Ivan Borello did a study looking at giving Revlimid and then adding a vaccine versus giving the vaccine and then after the vaccine is given, give the Revlimid and then go back and give the vaccine. Patients who got the Revlimid first and then got the vaccine did better as far as response to the vaccine. But what really was beyond impressive is that the patients who got that particular sequence of the Revlimid first followed by the vaccine was Pneumovax. Those patients had actually a stronger anti-myeloma activity versus those who got in the vaccine, then Revlimid, then got the vaccine. It seems that there is some tolerance that developed, that the response to the vaccine was significantly lower in those patients, but also the response to as far as myeloma and the durability of that response was less. So in a nutshell, if you look at the whole picture, and this is really a micro picture of the human body and the complexity in it, there is literally over 3-4 dozen different components here. That's what we know of that are interacting with each other, with each other at different times, and depending on the sequence of the stimulation or the inhibition of them. And at the end of the day, it's not just you have a certain number of T cells or a certain number of B cells or a certain amount of cytokine. The importance, Reza, is to balance that numeric and functionality of the immune profile. And that whole area is really evolving, and we're hoping that in the next 5 to 10 years, we'll be able to kind of hone down a little bit onto how we would manage the disease, controlling it with the least amount of side effects and the most impact on the patient's progression-free survival, as well as the overall survival. So with here, I'm going to stop, and I guess the questions at the end, I'll be more than happy to take them when you guys all are taking them.
Thank you very much, Dr. Hussein. And that is indeed quite amazing how sophisticated that is. We now turn, last but not least, we turn to Dr. Farha Abbasi. And Dr. Abbasi is an assistant professor in the Department of Psychiatry at Michigan State University. And her areas of interest are cultural psychiatry and teaching medical students how to provide culturally appropriate care to Muslim patients. She is the founding director of the annual Muslim Mental Health Conference, and she also is the managing editor of the Journal of Muslim Mental Health. And in fact, when people think of Muslim mental health, I think Dr. Abbasi is across the board the first person people think about. And she has received numerous awards. So with that, I'll turn it over to Dr. Abbasi.
Thank you so much. First of all, Dr. Nassiri, I did try to trace my ancestral roots, made it back till Iraq. And some thoughts are like possibly Palestinian, settled in Iraq and Iran, I guess. So definitely a connection there, I'm sure.
Very good.
And thank you so much for both my esteemed panelists and Mohammed Khalil for including me in this presentation. And I guess always been very inspired by Avicina, Ibn Sina, but I will try and take him to mental health. So he has done amazing work in the field of mental health as well. So I will talk about him as well briefly. But when I look at the Muslims' contribution to medicine, and especially from mental health perspective, I think the first book that I find that is talking about mental health is Quran. It's amazing that Islam is one religion that you can be born Muslim, but you are not practicing Muslim till you have the competency. You understand what being a Muslim is. So Islam is a religion really based on mental competency and talks about majnoon, which means somebody who does not have control of his or her faculties, and instead, and they are exempted then from all the duties, religious, societal duties, and actually society has to take care of these majnoons. So we also see that periodically Quran does talk about, acknowledges natural human feelings of huzn, malal, feeling sad, grief, bereavement, also, but at the same time, constantly giving hope and living in wellness. So to me, when I became a psychiatrist and started reading the text, I was shocked that literally everything in Quran is about your physical wellness, but also as much importance as your mental wellness. So it says, indeed, mankind was created anxious. It also says that perhaps you would kill yourself through grief over them, O Muhammad sallallahu alaihi wasallam, if they do not believe in this message. And out of, and out of sorrow. So constantly there is acknowledgement that the life strife will create depression and anxiousness. Even the prophets who has the highest level of spirituality, religiosity, and faith can have grief and feelings of sadness. And we do see Muhammad practicing meditation, taking care of himself, doing things in moderation, eating in moderation. So to me, this is amazing, but also at the same time, how the message of hope is being given to you as well. So not only validating your feelings of depression and anxiety, but also constantly acknowledging that you do have the strength, you do have the coping skills to keep up with it. And then the reward of coping up in times of strife. So on one hand, constantly you are being told about the strife and the test and the exams, and then also being validated for the strength and being taught the coping skills. So unquestionably, by the remembrance of Allah, hearts are assured. And I love this verse, indeed with hardship will be ease. So how I used to interpret it is that after every hardship, ease will come. But now when I talk to scholars, it's hardship is within ease. The ease is within hardship. So it's two parallel processes happening at the same time. And also when we talk about Sharia, the path to religion, which we know Sharia talks about your relationship to God and to the relationship to each other. But what amazes me is that as you are supposed to protect your faith, your life, intellect lies right there. So you have to protect your akal as much as your nasl, mal, faith, and nafs. So we see that most of the practices that Islam emphasized on or kind of purported is also that how do we preserve our intellect becomes extremely important. So anything that would take you away from your intellect, be it anger, extreme emotions, extreme sadness, substance use, or anything that impacts your judgment, ability to understand, ability to make good decisions was prohibited. So I see these three very interwoven concepts in Islam, that wellness, welfare, and being in community. And now when I look at the mental health practices right now, these are the very much concepts that are being embedded in therapy. So your wellness is supposed to be intertwined with the welfare. So something that starts with individual wellness has to flow into the wellness of the society, which turns into welfare. And then you are encouraged to do everything within the community or bring it back to the community. And now we are understanding that the latest research shows us that loneliness is as bad as smoking 15 cigarettes a day. So to me, it's amazing that when I look at the history of mental health and the contributions of Muslims, that they very well understood these three concepts and brought them to their care, to their work. So that's why it doesn't surprise me that the first psychological unit or hospital is built in 705 CE. So pioneers like Al-Razi and Ibn Sina, which Italians turned into Avicina and started calling him Avicina, and we adapted to Avicina, but his name was Ibn Sina, like Dr. Nassiri mentioned. We see they established the first mental health hospitals and applied humane treatments. So they were not treating mental illnesses as something different. They were treating as a whole, mind and body was brought together. And these first one was built in Baghdad. But what is extremely interesting that these mental health hospitals were not excluded and alienated or separated from the mainstream communities. They were built in the center of the cities or close to masajids, so that the community can be involved in the care of those suffering. So there is wellness being integrated, welfare being brought out, and not only that, historically, the literature tells us that they were not only taken care of when they were there in the hospital, but when they were discharged or released into the society, they would be given financial, emotional, economical support to be rehabilitated back in the society. And by keeping it so central, there was no stigma or shame around it. It was very accepted and acknowledged. This is a picture of one of the earliest picture I could find. So we also then comes to another genius work, which is Abu Zaid al-Balkhi. Abu Zaid's book was entitled Masle al-Abdin wa al-Nafs. So again, Arabic not being my first language, but the best Malik Badri, the eminent scholar, we recently lost him, unfortunately, translated it as sustenance of bodies and soul. And this work is centuries ahead of where we see work being done in Europe or Western society. So the concept that mental illness is a new phenomena or Western phenomena is dispelled by when we look at our own history and literature. So centuries ahead of his time in realizing the importance of both mental as well as physical health for human well-being. The diagnosis of psychological elements, including stress, depression, fear, anxiety, phobia, and interestingly, obsessive compulsive disorders, together with their treatment by cognitive behavioral therapy. So what we are seeing now in our literature and DSM, it was very clearly delineated, diagnosed, and discussed and treated by al-Balkhi. So he also was very successfully able to differentiate between exogenous causes and internal hormonal and chemical disturbances. So he understood the biopsychosocial model of the disease, which we talk about now. So he understood fear, panic. Fear was al-khawf, but panic was al-faza, like severity. The panic attacks were described. Then anger and aggression, al-ghadab. Then sadness versus, so everyday sadness versus clinical depression, al-huzn wa al-jaza. So huzn is everyday sadness and wa al-jaza is clinical depression. And then al-waswasa, obsessions. So very clear descriptions of obsessive compulsive disorders that we don't see almost till a century later in other literature. So he's really ahead of his time. And again, his book, first chapter is Nafs, second chapter, Sustenance of Psychological Health, chapter 3, Ways of Regaining Psychological Health when one loses it, chapter 4, Enumerating Psychological Symptoms and specifying their distinguishing attributes. So signs, symptoms, diagnosis, literally like a DSM distribution. Chapter 5, how to counteract anger and get rid of it. So to me, that's extremely interesting, that anger is being diagnosed as one of the risk factors for your mental health. And right now we see that problem in our community where we have patriarchal society or gendered society, that this uncontrollable anger in men is not understood or counteracted or coped with, because we don't understand it as a vulnerability. We take it as a masculinity or a sign of strength. Chapter 6 is how do you tranquilizing fear. So understanding fear, phobias, panic attacks. To me, I'm just amazed when I see this work. Methods of dealing with sadness and depression. So you are talking therapy, you're talking medicine, mental maneuvers to fend off the recurring whispers of the heart and obsessions, inner speech of the soul. And of course, Al-Baqi, then we also see the parallel work with in Canon of Medicine by Ibn Sina. And you have talked so much about him, but I will briefly talk about his work with the mental health. So this was very intriguing for me and very fascinating, that what we see now as developmental theory, or we see Erickson's stages of aging, we see same way Avicina has divided it: period of growth, adolescence, prime of life, elderly life, and then decrepit age, so senility. So very similar to the work later replicated. And then, of course, he describes epilepsy, apoplexy, stroke, paralysis, vertigo, spasm, tremor, meningitis, amnesia, dementia, talks about impact of head injuries, hysteria, conversion disorder, fainting, stupor. So literally, I could not find a diagnosis that was not already talked about. Sexual disorders, love sickness, delusions, hallucinations, insomnia. So like Dr. Nassiri said, the impact of sleep that we are now realizing on mental health, he already talked about that. He's describing nightmares, mania, psychosis, melancholia, paranoia, asthenia. I mean, it's complete covers the whole spectrum of mental illnesses. But what is really amazing is that he not only talks about therapy and impact of exercise, sleep, nutrition, literally the words that we are using now, but he develops so many medicines. So we see antidepressants, anxiety medicines, stimulants that he introduced and was using. And really encouraged the model of bringing therapy, lifestyle changes, and medicine together, which is the golden rule of practicing psychiatry right now, is bringing it all together, taking in mind and body together in the wellness movement. He was the major influence about history of Islamic psychology. So we see now Islamic psychology has become such an important branch of our work in mental health field. But he took the ideas from the Greek philosopher and adapted them to the Islamic doctrine. He began with Aristotle's idea that human possess three types of soul: vegetative, animal, and rational psyche. So id, ego, superego. So he was so, had such depth of knowledge and so ahead of his times. In therapy, analyzes the human soul, mind, physical stream, intellectual, dreams, prophecy, men's desire. So it's very interesting. On one level, he's doing life medicine. He's also using cognitive behavior therapy, but he's also almost doing psychoanalysis, what would be termed in a modern language, psychoanalysis. So he's also interpreting dreams and men's desires, ego, superego. So really fascinating. I think the most important message for me as a faith-based provider and someone who works in the Muslim community is we need to go back to our roots and own it, own the great work that's being done, and it's continuing to be done. We still, I see we are so ahead in the field. It's just unfortunate that we have not, I think we need, ownership is the word. We need to be proud of our heritage and our knowledge and wisdom and bring it and interweave it with our work in modern times. So with that, I would end. Thank you.
Thank you so much, Dr. Abbasi, for a very interesting presentation. And it is interesting to see the extent to which mental health is addressed in these pre-modern, medieval works. Very interesting. Well, it is now time for questions. So I'd like to encourage the attendees to type in their questions in the Q&A box. If you're on a laptop, you might see it at the bottom, or you might see it at the top. If you're on your phone, you may have to look around a little bit, but look for the Q&A and you can type in your questions there. In the meantime, I'd like to see if there are questions from the panelists. I have a question myself, so let me go ahead and pose it, and then we can see if there are other questions. But my question is this. We have discussed at length these incredible pre-modern advancements, discoveries, etc. And one of the big questions, and this is a difficult question to address, one question that often comes up is what happened? Why is it that when we look at, advancements in medicine, we see Muslim names in the 12th century, 11th century, 12th century, but then as we get into the, 17th century, 18th century, the names that we see tend to be European non-Muslim names. Of course, part of that has to do with who is presenting it, but part of that is also what's going on the ground. So I wonder if you have thoughts on this, and whoever would like to take this first.
Can I start?
Sure.
I think it's primarily due to industrial revolution in Europe, where they developed ideas, including the idea of Renaissance. And although the idea of Renaissance was primarily philosophical, but that tied it up, very nicely with advancement in, we say, san'at means, industry. And that's one of the major reasons, then we fell behind because of the Industrial Revolution took place in UK, then it spread, throughout the Western Europe. So that's one of the major factors. The other factors, I think we need to be realistic. During the golden age of Islam in Andalusia, okay, and I visited that region many, many times when I was in Paris, was that Muslims were great physicians at that time, okay. As a matter of fact, the Vatican, their priests, when they had sickness or illness, they used to send their priest, and we're talking about 2 months of travel, okay, from Rome all the way to Andalusia to be seen by Muslim physicians. So we had an empire of medicine in Europe, but I'm sure you all know then it got into the politics and to the way, in the way that the British and French, they had harmonized their goal or objectives, to go after Muslims in Andalusia, and they pushed them back into North Africa. And that is a second reason. The third reason that I'm sorry to say that, but we have to be realistic with each other. As a Muslim, we have to be honest, you know, that's the commandment Allah subhanahu wa ta'ala asked us to do. I think, you know, there was a nifaq between us. Nifaq meaning we couldn't get along with each other. There was a conspiracy. And I don't want to go into the root of conspiracy because what is past is past, okay? We just cannot go and revive it, you know. We have to look into future. We are actually, you know, I would say, as I review for 5 medical journals, you know, I do come across actually with great research articles, you know, from Pakistan, from Egypt, from Iran, from Saudi Arabia, other Islamic countries. Malaysia is one of them, Turkey is another one. I think there is a revive in our Muslim scientific research. And an example is very clear here in the United States. You see many Muslims. When you go to NIH, you see many Muslims. They're working as a scientist there, you know. And here, 3 of us, even including you, Dr. Khalil, you know, you're contributing as a scientist, you know, to the development of medicine one way or other. You know, medicine is not about just here's diagnosis and treatment, okay? There are many facets of social assets, you know, religious assets. Dr. Abbasi talks about psychological assets, you know. So I think we are coming back, but not in a pace that we should. So that's the 3 reasons that I was able to offer.
Thank you, Dr. Nassiri. And actually, you did raise an interesting point about the prevalence of, you know, Muslim physicians right here in the United States. I remember maybe a decade ago, the comedian David Letterman said that his doctor told him to face Mecca and cough. He was saying that as a joke.
I remember that. Yes.
Yeah, but his point is that there are so many Muslim physicians. Anyway,
And scientists.
1 in 22
1 in 22 physicians are Muslim.
are from Muslim. Yeah, almost 5%.
Wow. Very interesting.
So I also feel that at some point we separated religion from science, that being scientific or talking about Quran and Quranic verses in lieu of science became unacceptable. So I think there was a deliberate movement to separate religion from science. And I do see that's where although we see that what is termed as dark ages here, that most work in the Muslim world was being done during that time, and the Renaissance came from the work that we, the Muslim scholars and researchers had done. So it's unfortunate, but given the latest, even with the COVID vaccine, we saw the Muslim couple contributing greatly to the development of the vaccine, that I think we need to own that and come back and bring it back. But I also feel that the process will not be external. The others will not do it for us. It has to be internal. And another point that Dr. Nassiri made in the beginning, I also feel that the internal politics of being Muslim is also impacting that we talk about Avicina and own him, but how many in this modern world of clinical practice are we owning each other, or are we celebrating each other's work? Somebody from Persia or somebody in Iraq or in Pakistan or India. I think the politics, the internal politics is also dividing us and not is a barrier for us to benefit from each other.
Dr. Hussein?
Yeah, no, I agree with both, and I really truly believe that thinking religion is different than science, or they don't cross, or they don't mix, have caused some of the issues. And I think part of it is our knowledge of the religion and of the Quran itself has really deteriorated to the point that we really don't know our own, which made it really harder to be able to do what Farha is saying, is show that both of them, there is really no conflict between them and they really support each other. And as time goes, you realize that there were things in the Quran that was 1400 years ago we're becoming to understand it now is becoming true. And I think that really have got us, many of us, to shy away, but usually people shy away from something they don't know very well or they don't understand. So they pull back because you're just not sure what to say. So I 100% agree with Reza and Farha on that 100%.
Thank you, Dr. Hussein.
Sure.
We do have some questions in the Q&A. Any comments before I go to the Q&A?
If I may just elaborate on what Dr. Hussein said. You know, Jacques Cousteau is a famous oceanographer, French oceanographer. When he was in Mediterranean Sea, you know, he discovered that part of Mediterranean Sea, the warm water meets, you know, cold water. So he was very gratified and very happy about it. And he announced it in his oceanography, you know, ship, a huge ship. And it happened that an Algerian Muslim was there and laughed at him. He said, "What are you talking about?" He said, "Well, I discovered." He said, "It was discovered many, many years ago by Islam and our book." And he precisely showed the verse, I forgot the verse, that where in Mediterranean, you know, Sea, there are waters, you know, they may have different temperature.
That's true.
So again, it reemphasizes, you know, our lack of energy to go and study the book and the concepts that presented in the book and how much it really relates to our modern medicine or other modern things, you know.
Mm-hmm. Forensics and law and legislative.
Right.
Well, thank you for your reflections. We'll now turn to the Q&A. We have a question here from my colleague, David Stowe. The question is, was there any interest in animal health, ways in which we can learn about human health by studying animals?
Well, this is what Avicina did. Avicina didn't have cadaver. Okay, he basically had observations on animals. But certainly there are a number of animals, they share similar physiology with us, for sure, you know, and the pathophysiological concept. And many of our discoveries, you know, especially drug discoveries, thanks to animal, you know, research, you know, certainly animal research contributed significantly to not only our understanding of a pathophysiological mechanism, but also to drug discovery, although, you know, concept is shifting a little bit, going into, you know, different, you know, pathway, but yet there are certain diseases, you know, you need to study animals in order to better understand what's going on.
Would others like to add to that? Okay. The next question. Oh, go ahead. I'm sorry, Dr. Hussein.
No, I was going to say, Reza really worded it beautifully. So.
The next question is, how far can the modern sense of the Muslim physician go to alleviating what seems to be a Western-centric obsession with locating health outside of the spiritual dimension of beingness? Surely it is here where the Muslim physician can have the most impact.
Mohammed, go ahead.
It's kind of tricky. I think I think a couple of things, and this is really not going to be easy, and this needs to be, if I understand the question correctly, I think it has to be in sort of an interfaith kind of process. I think I tried to do this when I was at Cleveland Clinic. I thought everybody would love it. And we had a day where we talk about faith and medicine. And we had a rabbi, we had a priest, we had an imam, and it was a huge failure. It was a huge failure. I got criticized by all patients. Religion is something private. You can't talk about religion. So I think this is going to have to start, not end with a conference like that, get everybody together. It will have to start sort of at the base. It take a couple of years to kind of educate people that they don't conflict, Judaism or Christianity or Islam. And then people will mentally kind of start to understand that and then build on that. And then this is the part that we truly can be in a very, very good position, because there is quite a bit of teaching in Islam, but also what even is more important is, like Ibn Sina, you have somebody who's been able to kind of get that far with utilizing parts of the religion and understanding the different herbs. We all know that God says, for every disease, or I have a cure, or there is a cure. And we don't utilize that, and our job is to look for it. I think it's a really a big issue that needs to be addressed, but it will take a huge effort. I don't think it's going to be as simple as naively as I thought it would be, and it really did not work. It really caused me a lot of grief.
So I'm glad I have a more positive story to tell from mental health point of view. There is a huge movement, especially when we started the wellness movement, that we started bringing mind and body and spirituality together. But there's a huge movement in mental health field to bring faith-based mental health, understanding the importance of religiosity and spirituality in your healing and resilience. And in fact, we have great institutions working on it, from American Psychiatric Association, American Psychological Association. Everybody has a faith-based component. A lot of research is being done. And we, they all talk about how Muslim mental health field is so far ahead in that work. And we have interfaith task force for suicide prevention, for intimate partner violence protection. So amazing work being done. One example that comes to my mind is Kennedy Forum. Patrick Kennedy talks about his own struggles around mental illness and how religion saved him. So amazing work being done. So I feel more positive with the outcome. Of course, when we teach in what we are doing now, because there's a separation of state and religion, but what we are doing as teaching medical students now is that as much as it is important to take other clinical history, it's extremely important to understand take a faith-based history, that is religion a source of distress or your resilience. So a lot of work being done in our field.
Yeah, no, in your field, I mean, the way you approached it, to be honest with you, Farha, is really impressive. And I think if I would have approached it your way, it would have been more successful. I approached it more from the treatment, and you have to have a belief in the treatment and belief in God will help you and this and that created chaos. But with your way of thinking and being part of the distress or the comfort, and kind of going at it from that psychology point of view, which really is psychology, that is a very impressive way of approaching it. And that should have been maybe the way I would have approached it, is have people with psychology, psychiatry background be involved and try to look at it from that point of view, because that makes a huge difference in those patients. Well, congratulations. Really impressive.
Thank you. But I'll tell you, it wasn't easy. The first time I put Muslim in front of mental, I got two very fierce emails, one saying that how dare, it was from a faith leader, how dare you put Muslim and mental in the same line. And the other was, I'm glad you are fixing all the Muslims. They need help. So I understood from those two emails that my work lies right there in between.
It's a lot of work. Yeah. Yes.
Dr. Khalil, that was a brilliant question. I don't know who asked that question. And if I may elaborate on that. Yeah.
If it was brilliant, then I asked it. I'm just kidding.
Well, I think the world, including Muslims, they should recognize the holy book of Quran is not about do's and don'ts. Really, it's not. Okay, on philosophical basis. Quran is a compilation of do's, don'ts, but also advises you how to live safe and healthy. Okay. And then in one verse, actually, Allah, God, speaks that I gave you aql, ability to think. Now, to support what he said in the holy book, he also gave description of how embryo develops. Okay. I mean, what else could be more brilliant and convincing and that on one hand, Allah says, I gave you ability to think, and here is an example. So this is a book, okay, that should be considered not only as quote unquote religious or do's and don'ts, but really it goes beyond that, okay? So in other words, you know, Allah is telling us, look, I am giving you, there's so many other examples, by the way. I'm giving you an example. So because the book was thought in the era of Abbasi, Safavid, many dynasties, you know, especially in greater Syria, in Baghdad, then, you know, greater Khorasan, you know, the scholars of Quran, they literally went word by word to educate the members of the community. So in other words, imagine Quran, okay, I'm not saying it's a book of physiology, you know, I don't want Muslims to send me emails, you know, and condemning me, you know, but it gave you concepts, okay? So the early scholars of Quran built up on that concepts, okay, as a teacher, and they had followers. I'm sure Avicina, Abu Ali Sina, had a teacher, I'm sure, okay, who encouraged him not only be a Muslim philosopher, but also encouraged him, probably said, hey, you know, here's a verse about embryo. Why don't you go, you know, think about it, okay? So in other words, we had Quranic inspirations during the 9th and 14th century to go because there was a guidance in the book who encouraged us to conduct research.
Can I just quickly add, there was a comment, and I do want to mention about Muslim chaplains doing an amazing work and bringing faith and healing to their patient care. So I just wanted to acknowledge that comment. Thank you.
Yes, thank you. And by the way, that the question before that was from Hafsa, and Hafsa writes, thank you, I'm Hafsa, a visual artist filmmaker from a biomedical science background. So pleased and reassured with your comments, thank you. So that's from Hafsa. Thank you, Hafsa. And you mentioned, of course, already the comment by Jay, Dr. Abbasi. So the only thing remaining is there's a question here. It's kind of a general question, and I think you kind of addressed it, actually, Dr. Nassiri and others. but the question is, should Muslims read the Quran every day for mental health? And it seems like that is something that you kind of all were saying, it would seem. So.
It's very interesting that not only reciting Quran, understanding it, using it for meditation, but the 5-time prayers, those are the best thing you can do for your mental health, because you're not only doing yoga, you are meditating. And when you put your head down, you are letting blood flow to your brain. That decreases your anxiety. And also just the psychological impact of giving up control, giving up power, giving up your stresses of the day. And now we are talking about how important it has become to do small periods of movement rather than sitting for long periods. So 5 times when you get up and pray, you are not only physically getting active, you are meditating. Also, when we do wudu, you are running water over your pressure points. So to me, every practice in religion is embedded in your wellness. So definitely there is importance of meditating, but I think I cannot emphasize enough that it's not only recitation, but understanding and application. That is the essence of that's the most benefit, but that's when you get the most benefit of Quranic verses.
Thank you, Dr. Abbasi. We are actually technically out of time, but I'll just see if there is a quick comment from Dr. Nassiri or Dr. Hussein after that.
Well, thank you for the opportunity to talk about Avicina.
Yes, thank
It's
you. Thank you,
always a
Dr.
pleasure to
Really
see
impressive.
friends on
Yes,
virtual.
yes. No, it's really, really very good, and I learned a lot, from Farha and from Reza. It was really very educational for me. Thank you so much.
Thank you again.
Well, thank you so much, everyone.
Thank you.
And I want to thank Dr. Nassiri for proposing this in the first place. Thank you so much. Well, thank you, everyone. And this concludes our session. And thank you for joining us. Thank you.
Assalamu alaikum.
Appreciate it.
Walaikum salam.